Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hey, this is Dr. Tom Rogers at Performance Medicine coming to you with a weekly podcast of what I call the Common Sense MD. Now, I've got two guys here that have been on a podcast before, Dr. Nate Wells and Jake Hubbard. I call him Zach sometimes, but he really goes by Jake. But in any event, they've been on the podcast before. They own Brookhaven Farms, which is now the only place that I buy any kind of beef or eggs or anything. I'm a total convert to your farms, and I absolutely love it. You know, when I had you on last time, I hadn't eaten the variety of foods that I have now, and it's just incredible. The taste, I brag about it all the time, and it's just amazing. But we're going to talk a little bit about the Brookhaven Effect today. You know, that's a new term for me. Doctor, what would you term the Brookhaven Effect? What do you mean by that?
Well, I mean, so the word effect comes from, anytime something, a cause and effect, right? And so the question is what is the cause and what is the effect? We can talk about, diabetes, what causes it, and the effects that it creates. The Brookhaven Effect is that we believe enough in what we produce that it's clean, and we believe in the concept that food is your medicine. And so the Brookhaven Effect is that if you exclusively eat foods from Brookhaven or foods like we produce at Brookhaven, the effect is going to be health. And the effect is going to be longevity, and not just a long life, but a long, healthy life.
You know, I've always been a fan of the carnivore diet. Again, I always say any diet works, any diet fails. It's really a lifestyle. But I have found that over the years, in seeing thousands of patients and living till 70 years old and experimenting with different types of nutritional patterns and having two diabetic children that you've raised up, you kind of know a lot about insulin resistance. So it's really not cholesterol, I've told you many times. It's really insulin resistance that causes disease, that and inflammation. And Jake gave me a good little statement earlier on. You had something I want to always remember. You said to me that with a carnivore diet, which means mostly meat, for some reason it helps everything. What makes you say that? I think you're right because I've experienced it myself, but what makes you say that?
Really, the question we should be asking is what is in the food at the grocery store that makes it so awfully terrible for you and make you feel so bad and causes all these problems? I said it once to you earlier. We are what we eat eats. So if you want to eat a steak that will fill you up and give you all kinds of nutrients, well, that animal has to be eating nutrient-dense foods, grasses, forages, all of those things. So,
well, these dogs are around here making noise, so don't worry about that. But as you see, Dr. Wells is here in his scrubs, and Jake is here, just got off the farm. So we all work for a living.
We do.
And we all have to eat. So you might as well eat something that's so nutritious. But the reason I wanted to get you back on here was not only to talk about the Brookhaven Effect, but we're kind of forming a mini little partnership because we all have the same goals, and that's patient health. And I can tell you one thing, the main thing that will affect your health in your lifetime is what you put in your mouth. There's no doubt that is what causes you to get sick or stay healthy is what you put in your mouth. And the other thing about it is, like Jake said, I mean, there's a lot of misinformation about what's in the food. If it's advertised, it's usually not really good. If you see it on TV, it's probably not a good food to eat. But processed foods are our main problem. Even when you get deli meat, I used to think I'd go have them slice up some boar's head and make a sandwich out of it, and that was great. But this stuff is not exactly even real meat, is it? I guess it's meat, but it's so processed that it's ridiculous.
There's a simple adage of if it can last longer than it should be in your stomach, it's probably not good for you, right? If the bread that you buy can last in your pantry for 3 months, that's probably not what belongs inside of you. You know, if you're going to eat breads or if you're going to eat things like that, at least make them as clean as possible. And I think that's where the carnivore diet in its simplicity works, is because in the end, it's hard to adulterate clean meats too much. I think there are good, better, and bests to everything. But I would argue that if you can't do Brookhaven, still the cleanest meat you can eat is still the best, is the next best option before going to chicken tenders at Chick-fil-A.
Yeah, I agree with you. You know, your meats taste so good. It was just amazing the difference that you can taste it. Your eggs are colorful and they're just wonderful. I guess the egg is a perfect food. But I just can't say enough about how your food tastes as well. And the reason I wanted to get you guys back was really not to kind of go over what happened in January with our wonderful no processed food month. We had many patients comply with that and came out feeling way better. And hopefully it's just a start to their changed lifestyle so that they'll cut out all the processed foods, at least the ultra processed foods. And that's not an easy task. So we want things to be convenient for people. And what I've started doing is ordering, my once a week delivery service from you guys, and it's amazing. I love everything you put in that. I even love your milk, your raw milk for your pets. So I can honestly tell you that I had a little stomach digestive problems, and when I started drinking that, it straightened them right up. So did the yogurt. I mean, it was just an amazing difference. At the time, I'd had a little respiratory illness and had to get on an antibiotic after a while, and I didn't have a problem with the antibiotic or milk, which I'm extremely lactose intolerant anyway, so I can't say enough about that milk and that yogurt. And your steaks are great too. But in any event, what we're trying to do here is kind of partner up a little bit with you guys, and we want you guys to be able to deliver to our offices so that people can just pick it up, place their order, pick it up, and just be convenient for them. And, we have all these performance medicines now, and I want my patients eating this kind of thing, because if they do, they're going to get healthier usually if they follow all the other directions that we give them. But the main thing, like I say, is what you put in your mouth. So how's this going to work? We're going to make a delivery once a week to each one of our performance medicine offices, and they place their order a couple days ahead of time, and they just come pick it up. It's just convenience.
Yeah, so all of our deliveries to performance medicine are going to be starting January 22nd. And the delivery is going to be every Wednesday from that day forward. In order to order, you just have to go on our website, www.brookhavenfarms.net, and then when you place your order, you will just pick the performance medicine location that you would regularly go to. And whether that be Johnson City, Kingsport, Bristol, or whatever office you go to, we're going to have those options available for you.
Well, that's just so convenient, because people, they want to go to the grocery once a week and they're shopping in the middle of the store. They're just picking up junk food because they're seeing it. Yep. There's a big visual effect on food. But in any event, we're really excited about this. I know I don't look too excited right now because I've had a little cold, but I'm really, really as excited as anything I've been excited about in the last year is really kind of getting this thing going, because you guys are doing it for the right reasons. Your families are healthy and nutritious, and having two diabetic kids, of course I'm going to order the food for them as well. Right. I mean, their blood sugars are not going to go up by eating meat or eggs, is it?
Nope. It was the original diabetic diet, right?
That's exactly right.
It was the diet that before we were able to create insulin, the prescription was a low carbohydrate diet, a primarily meat and fat diet, and children lived a lot longer until we were able to correct that.
I'm not against being a vegetarian or a vegan, but I've found through the years that they eat too many carbs, they eat too many grains, and it's just hard to get good quality stuff with that. Some people do fine with it, but for most of my patients, like you said, they get better when they go on more of a carnivore diet. Now, I also am good with local, fresh fruit in season.
agree.
And some vegetables, But the way that the Americans nutritionists push nutrition is eat more whole grains and all this stuff. And we've got so much soy out there, so many bad things for us, and they push it as being healthy.
Right.
And I think it's because they're getting paid off. But
There is some evidence that would suggest that's true.
But I like eating local. I love local, raw, unfiltered honey also. You know about that. They're in every office that I have. But anyway, I'm really excited about this, guys. So you're going to be delivering weekly, and they can go to your website and pick out what they want.
Yeah, and two, you won't have to worry about waiting for me to get there or waiting for one of our delivery drivers to get there and coordinating the times of those such things. Those boxes are going to be available all day on Wednesdays. And so you don't have to, you can go when it's convenient for you, because at the end of the day, we are partnering with Dr. Rogers for your health and your convenience. And in those things, they're going to be at all the offices. So.
I'm even buying freezers.
And we know that compliance a lot of times comes with lowering the barrier, right? If it's easier, it's more likely to happen. I know that as you know, most physicians would agree that compliance is always hard. But if we can take away some of those barriers, that's what we really want to help do.
I'm really excited about people starting to eat healthy. Just try it. I mean, you'll notice a huge difference in the way you feel. You're not going to experience hypoglycemia and a lot of brain fog that you normally have. So give it a try. We call it the Brookhaven Effect. Yep. Which one of you guys came up with that? Brookhaven Effect.
Nathan came up with the Brookhaven Effect.
Did Nathan come up with that? Okay.
And part of that is that we want to add that Jake and I are going to go under Dr. Rogers' protocol and follow his scripting. And so we want you to follow us along as we enact the Brookhaven Effect. What we would love for is people to tell us their stories of what happens for them when they go on the Brookhaven Effect and share, and we create a community of people who support each other in gaining health through Brookhaven foods, but also just Brookhaven-like foods.
I love it. For a few years now, I've had my own line of vitamins made out of Oregon with no fillers. So I've had great vitamins that we sell it, and you can order online. Now we have great foods for this, because this is the best there is. I'm convinced this is the best food you can eat for yourself. So check out Brookhaven Farms. Go to their website. We're going to start doing some regular podcasts, and we'll get out there, and you can come and ask us any questions. But I'm telling you, give this a try. You'll be amazed at how you feel and how good it tastes as well. So thank you guys for coming on.
Yep,
we'll
thank
keep
you.
doing this on a regular basis. And actually, we're going to go visit the farms and do a live broadcast from out there in the springtime. So thank you for listening. We'll see you guys next week.
Thank you.
Thank you.
Jake, walk me through the ordering of a box, which is what I'm doing. How do people order a box?
Yes, so you go to our website, www.brookhavenfarms.net. On our website, you'll see a tab where you can add to the cart our Brookhaven Butcher Box. And in that box, you're going to get 4 pounds of chicken. You're going to get 4 pounds of ground beef. You're going to get 4 pounds of pork. 2 of those pounds being 1 pound packs of mild sausage, and the other 2 pounds being mild sausage patties. You're also going to receive a pound of hickory smoked bacon, as well as a dozen eggs. Also in that box, you're going to have the option between a gallon of raw milk, like you talked about earlier.
For your pets, right?
For your pets. Or you could substitute that milk with a ribeye steak. And so that is going to be in the base box. A lot of people, like me included, and a lot of people that I know, they want more things than just a box. Maybe they want to have steaks on a Saturday night or a Sunday, and they want to add things to that box. So the box is going to be one item. So you just add that to your cart, and then if you would like to add additional items to your cart, you would just go back to the shopping area of our website, add those things to your cart, and then you would check out. On the checkout menu, you will have to pick a means for delivery. You can pick every performance medicine location. is going to be available there. As well, if you're not local, because I know you're very famous and you have lots of people all over the country,
Yeah.
we will be able to ship anywhere in the entire country this Brookhaven box. And so we would just like to invite everybody to come experience the Brookhaven difference through the Brookhaven Effect and order our box and get you some good, clean food in 2025. We would also like to add that we offer our beef liver tablets, and those will be available on our website as well. So.
Wonderful. I love beef liver tablets. That's the number one supplement nutritional-wise probably would be a beef liver tablet. Grass-fed, just wonderful for you. Well said.